Welcome to Stem Cell Genius, powered by R3 Stem Cell. I'm your host, Samantha Brechner, president at R3, and each episode, I sit down with our founder and CEO, Dr. David Greene, to answer your most pressing questions about regenerative medicine. From stem cells, exosomes, and PRP to the latest breakthroughs in treatment and science, we're cutting through the noise and giving you real answers from one of the world's leading experts. This is Stem Cell Genius, your front row seat to the future of regenerative medicine.
And we're back, Stem Cell Genius video style this time. I'm here with Dr. David Greene, our certified stem cell genius.
Yes, I
you
got
finally
the title.
made it. So today, we're going to be talking about stem cells and tumors.
Yes, exactly.
Yeah?
We're going to address that topic. But first, it's interesting because we might as well have done the last few episodes in our pajamas. You at your house, me at mine.
Too bad we didn't.
And
we really screwed that one up.
So today, I didn't know what to wear, right? Because it's our first video podcast. I thought, is a tuxedo a little too formal?
I know. I texted him this morning. I said, so what are we going to wear today? We did get matching sweatshirts from Gap.
Yeah, we did.
That say nap.
That's going to come up. We're going to wear that for an upcome.
Yeah.
But I was
Maybe a rainy day.
I was in my closet at the same time. We were texting back and forth. So funny, unrelated story. And then I promise we'll get into the tumor thing. When I was 28 years old, and I had just moved back here to Scottsdale, I had a wedding to go to. So I went into Ralph Lauren to get a tuxedo shirt. So the guy says, I said, hey, I need to get a tuxedo shirt. He says, what prom are you going to? So part of me was like, I look very young. Thank you very much. And then the other part of me was like, do I look like a perv to you?
It's one or the other.
Yeah, could be both.
We're going to go with the young option. I think it's better for both of us.
I'll take it.
At this point in time.
I will take it.
So now we all can note that Dr. Greene's best stories always start with, so when I was 28.
I'm only 30 now, so.
I know. Time flies when you're having fun.
Yeah. Beauty of stem cells.
Yes, the beauty of stem cells. And no tumors.
That's right. Yeah, exactly.
Okay.
So I'll give you the conclusion first, and then we'll talk it through.
All right.
So we have no evidence that the mesenchymal stem cells that we use clinically around the world cause any increase in tumors or exacerbate, existing tumors, because as we all know, there's a large incidence of cancer around the world, and a lot of people don't know they have it.
Right.
It might be something indolent.
Right.
And then the question is, did stem cell treatment or whatever cause that tumor to get worse and become, clinically relevant? And outside of basic science studies, really not even animal studies, there's a little bit of basic science research showing that, but now we have some really good clinical research, peer-reviewed data showing it just doesn't happen.
Nice. I mean, we all have cancer cells, right?
Well, one of the reasons that cancer doesn't typically become overt is because of the mechanisms that we have, such as natural killer cells, T cells, B cells. Our immunology system helps kill cancer cells. We know this because if you're deficient in natural killer cells, you have an 8 or 10-fold higher incidence of cancer.
Sure.
So it's hitting us all day long.
Yeah, sounds like it. All right, so tell us about how do we know that stem cells are not exacerbating or forming tumors? I mean, can it do the reverse effect?
Well, there are some, just as much as there's basic science studies showing that, stem cells can proliferate cells and maybe cause a cancer or make one worth clinically relevant, there are plenty of studies which show the opposite, which show that they have an inhibitory effect. So, all of that is you can throw it out there into the ecosphere and the public and scare people, but at the same time, what is the truth?
Sure.
And as far as what we know, we do have some data that shows it as far as we know, in a large accumulation of studies, it just doesn't happen. So I'll talk about, before we talk about the definitive conclusion on cancer formation, we have to talk about the different types of stem cells.
Okay.
Because the answer is different.
Right, depending on the type of stem cell.
That's right, exactly.
Okay, so let's get through all the bad ones and then we'll talk about ours.
Yeah, that's okay. So let's talk about embryonic stem
Okay.
cells, not to be confused with amniotic, okay? People get confused about that all the time. Embryonic stem cells are the ones that come from one of two sources. Either you have an aborted fetus, okay, or a leftover embryo after like an IVF
Okay.
procedure, So there are plenty of people around the country, around the world, who have an ethical problem with either of those.
Yeah.
Even if it's an elective abortion and using those, and I'm not, going to get into politics or ethics personally, but I can tell you that MCell, which has been around for decades in the Ukraine, they have a whole program for that. And they use what they say are the equivalency of embryonic stem cells as far as how powerful they are. So as far as how powerful embryonic stem cells are, they are the holy grail. Because an embryonic stem cell can turn into any cell type in the whole body. So in theory, that's what we want. And that's, the holy grail, like I said. But they have not become clinically available really anywhere in true embryonic stem cell format. So in the Ukraine, they say that they're not truly embryonic because of the fetuses being a certain age during the abortion and whatnot. Regardless, embryonic stem cells have a problem. And the problem is that they replicate, and they copy themselves, and they often don't know when to stop.
Sure.
They don't have that, shut-off mechanism that mesenchymal stem cells have. So that's been one of the safety issues that we've never been able to overcome as far as, why they're not used. They were first discovered back in '98.
Is that the only safety issue? I mean,
No.
what can happen if they don't stop?
There are two main problems with embryonic stem cells. One is the cancer issue, because if they don't stop replicating, they can form a tumor. The second one is they still have what's called MHC2 markers, so they can get rejected.
Right, that's foreign to us.
Yeah, exactly.
Yeah.
So that's when you spark up an immunologic rejection reaction, and that's one of the reasons that any studies that have involved embryonic stem cells, they have to give immunosuppression,
Right,
like an organ transplant,
right.
which defeats the whole purpose of
the treatment itself.
Awesome, not so awesome.
And there goes your $6,000. Thank you. Bye.
Yeah, I mean, yeah.
Oh no.
Yeah. So for those two reasons, we've never been able to overcome those.
Yeah.
So then what are the other types of stem cells? Well, there's the mesenchymal stem cells, which we use around the world. There's also hematopoietic stem cells, which come from like bone marrow or umbilical cord blood. And those are not in the embryonic category. So those are the ones that we are really concerned about as far as what's the answer. First answer is it doesn't cause rejection, and we can, discuss that in a separate conversation, but the bottom line is they don't even have the markers to spark up, or if they do, they're such in small quantity, it's not going to be...
It doesn't spark a rejection reaction?
No.
Okay.
No, it doesn't. If someone's going to have an issue, it's usually from the what's it called, the cryopreservative or something like that, or the multivitamin.
Yeah, right,
right. Before the
right. I don't know if I've ever heard of anyone being allergic to a stem cell.
it's just something we haven't encountered.
Yeah.
Now, have we seen anaphylaxis over the 14 years? Yeah, we've seen a handful, less than a finger, less than I can count on one hand, but it's just not from the stem cells.
Yeah.
It's from something else.
Right, external to that.
Yeah.
That's involved in the therapy.
Exactly.
Sure.
Yeah.
Okay.
Yeah, so after we get through the embryonic discussion, which I'll finish up that discussion by talking about 2 case reports over the last 15 years. I'll put my glasses on for... So one of them was a gentleman, an adult, who actually went to 3 different countries to get treatment, and they talked about it as a complication of stem cell tourism.
Sure.
But essentially, here we go. He went to China, Argentina, and Mexico for a problem with his spine. I'm not sure if it was just regular back pain or what, but he had embryonic stem cell therapies in all 3 of those countries. And basically what happened is he had large tumor growths in and outside the spinal cord. So
After getting embryonic stem cells.
embryonic stem cells, so the ones we talked about from like an aborted fetus derivation. They talked about it being a neoplasm, a tumor, but it was not a malignant tumor. So
Tell us what that means.
So malignant tumor is something that could metastasize and kill a person. That's usually when they talk about dying from cancer, it's usually from a malignancy.
Okay.
Mal means bad, and that's the bad type of cancer. If you have just a benign neoplasm, then a lot of times you can just cut it out.
Right.
And then it's done.
Yeah.
Right? In and of itself, it's not going to be deadly. Now, it could grow at such a rate that it pinches on like your spinal cord or pinches on something like in the brain or something. It could affect your
painful.
vision. Yeah, I mean, it could cause all kinds of problems.
Yeah.
And that's what happened with this gentleman. It was not a malignancy, but it was fast-growing, benign, tumor growth. So in here they...
Other external things.
That's right, yeah. So in this paper they talk about how they had to do multiple surgeries to remove these tumor formations. They also had to do radiation to try and debulk the tumors. So that was a big problem, and that was back in 2016. Once again from embryonic stem cell therapy. So the other one was embryonic stem cell in a child. Looks like it was done for tumor formation, and he had it intracerebellar at the base of the brain, and then also intrathecal to try and help with a brain tumor.
With embryonic stem cells.
With embryonic stem cells.
So they were using embryonic stem cells to reduce a tumor.
Yeah, they were trying to treat the tumor with the stem cells. We don't do cancer treatments with stem cells. I'm not sure what the thought process was, right? That's not really the purpose of today's discussion.
Yeah.
But what they found is that a few years later, they found multiple lesions in the brain. Once again, those were benign, but he already had brain cancer, so this kind of compounded the whole situation.
Yeah.
So bottom line is it's not safe to use embryonic stem cells. And we don't know if it's ever going to be safe to do that. So many billions of research dollars go into embryonic stem cell research, and it hasn't resulted in anything viability of approvals around the world.
And how long would you say all of this money has been poured into embryonic stem cell research?
It was 98 when embryonic stem cells were first found, and those were in, I think, mice.
Okay.
And then it was like 5 years later when they discovered them in humans. So we're over 20 years in.
Okay.
And nothing. Now I did find a paper looking at induced pluripotent stem cells. That's an interesting concept out of Japan, where you could take like a fibroblast, like a skin cell, that's a specialty cell, and de-differentiate it back to being a pluripotent stem cell.
And what is a pluripotent stem cell?
A pluripotent stem cell is one that, once again, it has the same type of power as an embryonic stem cell. It could turn into any cell type in the body. So think about it. If Mrs. Smith comes in and she's got a kidney problem, and you take some of her skin cells and send them to the lab and then de-differentiates them back to being a pluripotent stem cell, an all-powerful stem cell, then you could replicate those like crazy,
Right.
give them back to her, and that would be great if they could turn into renal cells and cure, Mrs. Smith's problem.
Right.
So that's always been the question of, okay, well, you've taken it back to being pluripotent. Is it still going to have that problem of replication? And we don't know exactly the answer, but there was a recent, it just came out this year, a phase 2 larger trial of iPS cells for Parkinson's disease. And this involved not that many, like around 10 patients. But they didn't see any tumor formation.
Okay.
And they followed them for 2 years. So we have that. But now this year, a beautiful paper came out. I don't think anybody could probably see this, but it's a peer-reviewed journal. Mesenchymal stem cell treatment does not result in tumor formation. So this was an accumulation of over 200 peer-reviewed studies that had done stem cell therapy through all kinds of different applications.
Sure.
Intranasal, intrathecal, joint injections, IV, nebulizer. And they pooled thousands of patients in these 200 and some studies together. And they found that out of all these studies, 12 patients developed cancer from the stem cell side of the equation, and 6 developed cancer in the control groups who didn't get stem cell therapies.
Okay.
So 6 versus 12 out of thousands of patients is not statistically significant at all. It's no difference.
So
So
we don't think that it has, why do we think that those 12, it has nothing to do with
it's just
stem cells?
part and parcel of aging. A significant amount of humans, develop cancer at some point in life. So, if you show that this amount of people get it who didn't have the intervention, the stem cell therapy, versus this amount who had the intervention and developed it, if it was like 120 versus 12, then you could say, aha. But,
Right.
6 versus 12, it's irrelevant.
Right.
Yeah. So that was how that played out. And it was great to see that. I mean, it wasn't like they pulled together 2, 4, 5. They pulled together like 217
Yeah.
clinical research studies.
Right. Do you know how many patients? Does it say or no?
I'm sure it does.
Somewhere.
Somewhere. I just saw that was a few thousand.
Okay.
And we've known through various basic science and smaller research studies that tumor formation, we don't have any evidence that it occurs as a cause of the stem cells.
And when did that study come out?
It just came out mid this year.
Oh, really? Okay.
Yeah,
So pretty recent.
very recent, yeah.
So anyone that's hesitant to get their therapy because they think that it's going to cause cancer, what do you say now?
Well, I don't like to speak in terms of absolutes,
Sure.
and tell them that it's a 100%. But as far as we know from peer-reviewed research over the last 15 years, and now we have this large meta-analysis with a huge thousands of patients pooled together, there is no statistically significant increased chance of someone either getting a tumor or cancer or a exacerbation of a cancer due to a mesenchymal stem cell therapy.
I love to hear that.
Yeah, and that's, at our centers around the world, whether it's autologous, your own, or, allogeneic, a donor, that's all we're using are mesenchymal and hematopoietic stem cells.
Right. So they're not the stem cells that just never know when to stop.
That's right, yeah. They're not embryonic, they're not pluripotent, which is what embryonic are, all-powerful. At some point in the near future, it'd be nice if one of those treatments became available and it can prove to be truly safe. I don't know if that's going to happen in our lifetime.
We can only hope.
Yeah. That would be sweet.
That That would be sweet.
Yeah.
I wonder if, I mean, this is just general question. If somebody does have a tumor, can stem cells help with that, or do we just know that it doesn't cause the tumor?
Yeah, it's not the corollary. I mean, we just know what we just talked about, but as far as, stem cells helping with eradication of a tumor, it just doesn't work like that.
Yeah.
We don't know. Now, we don't do bone marrow transplants or any kind of a stem cell transplant, meaning that the person's immune, they have a cancer, knock out the, do chemo and knock out the immune system and then replenish it with,
Sure.
stem cells from a match, either from cord blood or from bone marrow stem cells. We're not talking about that. Just, taking somebody who has a competent immune system, they have a cancer, giving them stem cells. We don't have any evidence clinically that it makes it worse, but we also don't have any that it's...
So that's why we just, at our international clinics, we choose not to give therapies to patients that haven't been in remission for at least 3 months.
Yeah, if they have cancer, whatever it is, and they're getting treatment for it, those treatments are designed to be cytotoxic. So whatever our providers would give them, it would just get killed.
Cancel out.
Yeah.
Right. You might as well wait.
Right. Exactly.
Sure.
Yeah. Now we do offer natural killer cell therapy internationally, and that
which can be used in combination.
That's right. Yeah, it can be used in a really nice combination with. After chemo,
radiation, whatever.
Like pre-surgical and then maybe post-surgical, because it's always good to have natural killer cells to eradicate any residual cancer cells.
And from my understanding, natural killer cells are basically white blood cells.
They're a subset.
Okay.
Yeah.
Okay.
So there's 2 ways to make them. We can talk more about this in a subsequent episode, but you can either take blood from the individual, autologous, and then process them. That's often a problem because people are so worn out and their natural killer cells, there's not that many left.
Right.
Because they've been using them to fight
Right,
cancer.
It's the same idea. If you don't have any, why would you try and take them out? Because you have none to give.
We're going to take your last little bit of NK cells.
And then just put it back.
And it takes a while, to culture those. So it's a couple trips. They have to come in, give the blood, and then come back a few weeks later. As opposed to the allogeneic ones, where we get blood donations from a blood bank, and then remove the natural killer cells, and then we're able to expand those one time, and they don't get rejected, and they work really well. And you get these patients, I'm laughing because it's beautiful to see it. When they get chemo, they do terrible. They feel worn out. They're just, all they want to do is go to sleep and not wake up. But when it comes to natural killers, they feel like a million/billion bucks at the end of the treatment. They're like, oh my God, and it's just such a different phenomenon.
Right.
It's awesome.
That is awesome. I know. We've spoken to a few people that have gotten the natural killer cells. Check out our videos on YouTube.
Yes. Visit naturalkillercells.com.
Yeah, seriously.
Yeah.
Cool. Do you have anything else to add? I think you answered most of my questions.
No, I think it was an important topic to cover because we get that question all
the time.
Online, or our consultants, and everybody wants to know, because there's a lot of and I did a video about this recently. There's a lot of competitors who try to throw that out as a reason to not undergo a donor cell therapy, and it's just misinformation,
right?
Being disseminated. So I think it's important to know accurate facts about it, as far as what is the peer-reviewed research showing, as opposed to what it shows in a salamander type of thing.
Yeah, absolutely.
Yeah.
Thanks.
All right.
Oh, I like that. Blow it up.
Yeah. You gotta do
Stem cell genius.
Actually, it's a Slay Girl.
Slay. All right. Well, you can visit us online at r3stemcell.com, or you can give us a call at +1 844 GET STEM to see if you or a loved one is a candidate. Anything else?
No, thanks.
Yeah. See you next
Genius.
time.
Genius out.
Genius out. El Presidente out.
Stem cell therapy is considered experimental and is regulated by the U.S. Food and Drug Administration, but is not FDA approved. R3 Stem Cell does not offer stem cell therapy as a cure for any medical condition. No statements made on this podcast have been evaluated or approved by the FDA. This podcast does not provide medical advice. All content is for informational purposes only and is not a substitute for professional medical consultations, diagnosis, or treatment. Reliance on any information provided by R3 Stem Cell, its employees, others appearing on this podcast at the invitation of R3 Stem Cell, or other visitors on this podcast is solely at your own risk. R3 Stem Cell does not recommend or endorse any specific tests, products, procedures, opinions, or other information that may be mentioned on this podcast. R3 Stem Cell is not responsible for the outcome of your procedure. The FDA considers stem cell therapy experimental at this point.